So surgery on a cataract with these instruments is what most people are familiar with. Last 30 years, it's been relatively unchanged.
That's right. Cataract surgery, which is a good procedure, really hasn't changed much. There's been some minor changes, but traditional cataract surgery that people think of when they hear cataract surgery now actually is done using 3 separate blades that are used to open the eye and remove the natural lens, allowing a new lens to go in its place. And these blades are smaller than they used to be. There's some advancements in that, but overall it's the same procedure.
But now, with a laser, just tell me, how different is it from traditional cataract surgery, being able to use a laser? Because you do both.
That's right. I do both, and when I first came to Boise, that's all that was offered, and so we did that. But, you know, the human hand can only be so good, and I think I'm good. I really do, and I think it's a good procedure. But the first time I did the laser, and now every time after that I use the laser, I think, wow, that's perfect. And look, it doesn't get better than perfect. And when it's your eye, right, you want perfection. And that's our goal as we try to move surgery forward in this new millennium, to have the very best, latest, and greatest, and no surprises.
Yeah, why wouldn't you want the laser now that it's available in Boise?
That's right. You know, I have patients ask, haven't you always used the laser? And the answer is no. We've only had it. We started doing it here in Boise May of last year, so that's May of 2017. Before that, every cataract surgery that's been done here in Boise and the Treasure Valley as a whole has used this traditional method with blades. Patients that wanted the more advanced options were going down to Salt Lake or Portland to get that technology. And a lot of patients are surprised to realize that they haven't had laser surgery all along.
Now, I think, like you said, we get that we have that perception because LASIK surgery, which corrects out here, corrects your vision, happens with a laser?
That's right. So LASIK surgery has been around and it's well known. People associate that with laser surgery.
Yeah.
And what LASIK surgery is reshaping the surface of the eye using a laser that creates heat and actually burns the tissue. Okay. Now this is like changing the prescription on your glasses. With cataract surgery, we're removing the old lens of the eye and putting a new implant in its place. And this laser doesn't burn. It makes incisions, it makes small cuts, and allows us to reshape the surface as well as open the eye and remove the lens without causing trauma to the eye itself.
So not using the old laser, it's a different
It's
way,
a new laser,
laser,
entirely different, newer technology, much more advanced.
Okay, exciting.
It really is.
Yeah, and you're measuring of the eye when you do that. There's new technology in that as well.
Right. In September of last year, 2017, we started offering something called intraoperative aberrometry.
Easy for you to say.
That's right. It's known as aura to the patients, and so we can just go by that. But we were the first in the valley, and just like with a laser, this technology has proven to be worth every penny. And what it does is allows us to take real-time measurements and eliminate the surprises after cataract surgery. So before, a patient would come in and have their measurements, and we would try to calculate what lens to put in their eye. Now when the cataract would come out during surgery, we would cross our fingers and put in that lens. We wouldn't know till the next day if it was right. And it wasn't uncommon that someone would look and things wouldn't be quite clear. And you put them up to that machine that's in our office, and they say better 1 or 2, and they like 2 better than 1, which means there's some prescription there. And we call that a refractive surprise. And it's not something you want.
No balloons and noisemakers.
Yeah, no, it's not that kind of surprise. And the goal is to eliminate those. So what we can do now is during surgery, we get that lens out. We retake the measurements and we can see exactly what their prescription is under ideal conditions. I can then calculate, implant, and align the lens perfectly and verify that there's no prescription left. If there is, I can change the lens out on the spot.
Right there.
Right there.
Having to come in and have
no further surgeries or touch-ups.
Amazing.
So we're trying to get rid of that surprise, and it's very successful. You know, we've gone from a good surgery to what's really as close to perfect as possible, and it doesn't get any better than perfect.